Hi, this is Naomi Fenlon at Cosmoskincare Solutions. I'm about to start an Isolaz treatment on a long-standing patient of mine who presented with pretty severe cystic acne, and we've done a variety of treatments on her. We're coming down the home stretch now. She is 2 weeks out from a Fraxel treatment, and this is her first Isolaz since that treatment. I'm going to go forward with the Isolaz, and then I'm going to be doing some extractions on her. This is a huge improvement for her from where we started. You can see there is still some residual scarring, although nothing remotely like what we started out with. And these are still, residual lesions. We'll be working on all of those today. And by the time we're done with all this is going to be pretty much gone. And are you ready to start the Isolaz?
Yes.
Okie doke, here we go. First pulse, starting down on your jawline where we always start. A little cold water. And here's your first pulse. And I always want to make sure that I cover any of the lesions that I see down underneath the jawline. It's a really common place for acne to start occurring with adult acne. And in fact, as acne progresses, one of the last strongholds for it typically is along the jawline, so I want to make sure I don't miss that. You can see her skin turning pink, which is to be expected. And essentially what I'm doing is I'm stamping with my handpiece to make sure that I don't miss anything.
Is anything going to happen when you go over that spot?
It may very well simply just explode right into the tip, but we'll see.
Because what is the tip doing?
The tip is vacuuming. It's actually creating a vacuum over that pimple. And what I mean by that is that there's a space inside of the tip itself in which a vacuum is created, not like a vacuum cleaner where it's sucking something out, but the air is being pulled out of this tip and a true vacuum is created where anything that can move will move, and in the case of this pimple it's going to be what's stuck inside of the pore. So we'll see whether enough of a vacuum can be created to actually break open that surface layer of skin and extract that. At the same time, the light which you see flashing with each pulse kills bacteria in the skin, which is just normal healthy bacteria that collects inside of these things causing an infection, and damages the glands, the sebaceous glands, which are responsible for creating the oil which contributes to the formation of a pimple. So here we go. And you can see it didn't break through, but it certainly brings everything to a head. So if I do this one more time, see if we can pull it right out. I'll get that when I come back and extract it, but that's the kind of a lesion that if you try to just do an extraction on that, you're going to have a really hard time getting everything out of that without pulling it up to the top first with the Isolaz. So we're going to just keep going along. How does this feel?
Just like it always does. Not too bad.
These little teeny tiny white spots that you see, those are actually the direct result of her Fraxel treatment 2 weeks ago. Those are little pockets of oil which the Fraxel laser hit and solidified, and now her skin is simply expressing them very effectively, and they'll be gone.
So do you manually extract them, or do you let them just come out themselves?
Sometimes I take them out, sometimes I don't. It just depends on what I see when I get to the point in her treatment today where I'm doing the extractions. I make that decision on a case-by-case basis. Now her skin is turning more red than it normally would. It's a bit fragile following the Fraxel. Normally she turns pink, not quite this red, and that's just because of the closeness in time to when we did that Fraxel treatment 2 weeks ago. So I'm going to come back, I'm going to do some extractions on